And but first, how do you recognize if someone is having a stroke? We brought in the professionals. Candace Mahoney joining us from Erlanger, who is a stroke program coordinator. And looking at some of the stats here, when it comes to strokes and stroke prevention, first thing, how many strokes do we have this year that you guys treat?
For the year of 2013, we treated a record-breaking 2,137 stroke patients just at Erlanger.
Now, oftentimes in this area, we are called the stroke belt. Maybe an elevated amount here compared to others.
Yes.
What, a little bit more about what that stroke belt is.
Yeah, so the southeast itself is called the stroke belt, and Chattanooga being kind of in the middle of that, we're considered the buckle of the stroke belt. So that means we have about 3 times higher number of strokes in our region than compared to the rest of the country. So a lot of that has to do with lifestyle of people in the South, eating lots of fried and fatty foods, and that can lead to all kinds of problems such as high blood pressure and diabetes and being overweight and just in general being inactive and having a sedentary lifestyle.
And there's also maybe a few other contributing factors too, with the smoking and some others out there.
Yes, absolutely. Smoking is a big one. Sleep apnea as well. Irregular heartbeat, like atrial fibrillation, high cholesterol as well. So.
Now, when it comes to recognizing a stroke or someone that might be having a stroke, what are some of those signs? Because sometimes it could be confused with a heart attack, or what is it that we need to look for? And on top of that, what does FAST stand for?
Okay, that's where I was going. The FAST exam is the easiest way to remember the main signs of a stroke. F-A-S-T, the F stands for facial drooping.
Okay.
If all of a sudden you notice the one side of someone's face is drooping downward, or you look in the mirror and you smile and your face looks crooked, that can be a sign of a stroke. The A stands for arm weakness. All of a sudden you're reaching for something and you realize you can't hold a cup of water, or you can't lift your arm up on one side as well as the other. That could also indicate a stroke. And then the S stands for speech. Speech changes such as slurring of speech or difficulty just getting out the right word that you're trying to say, or even not understanding what someone is saying to you. So anything related to speech. And again, the key word is sudden for each of those 3 things. And then the T, F-A-S-T, the T stands for time. It's time to call 911 if you notice any one of those 3 symptoms. There's about a 70–80% chance that you're having a stroke.
And there's several different variations, several different levels, and probably not the right terminology that I'm saying here, but the recovery, that particular process, is it improving? There is recovery.
Yeah, and if you come to a stroke center such as Erlanger, we have all of these great technologies and treatments that we can provide to you, whereas if you go to a non-stroke center, you won't be able to get those types of treatments. But yeah, like you said, it depends on the person. Every person is different, and every stroke is different. So there's not a hard and fast rule of how fast you're going to recover afterwards. It depends on the size of the stroke and all of that. But again, getting the FAST exam down, being able to recognize it quickly, and calling 911 immediately, getting to a stroke center and getting the right treatment, if possible, is essential.
Now we have just a couple of seconds here left because we want to make sure everyone knows about the big event that's coming up this weekend with the Chattanooga Lookouts.
Yes, Strike Out Stroke at the Lookouts. Erlanger is sponsoring this night to just provide some community awareness about stroke. We will have some of our stroke survivors recognized out on the field, throwing the first pitch and giving the welcome at the beginning of the game. We'll have some giveaways with t-shirts and some fast balls. We want everyone to have a perfect fast ball.
I love the connection. That's great.
Perfect fastball by the end of the night. Everyone will be able to recognize a stroke and know what to do.
All right, that's happening at the game on August the 30th. So do stop by and enjoy a great game and also a great cause too. For more information about stroke and of course about the FAST process, you're more than welcome to contact the folks at Erlanger Medical Center. The phone number is 423-778-5465, or just easy to remember, 778-LINK, or you can go to their website, erlanger.org/stroke. We appreciate you coming in.
Thank you so much.
All right, folks, let's say a big congratulations